Hi, everyone. We are opening up the webinar. We'll give folks a minute or two to dial in, and then we will get started. All right, it looks like we have a good group that's dialed in, and we'll go ahead and get started. Welcome, everyone, to the Arizona Spotlight CareMessage CM Light webinar. My name is Christine Chang, and I'm the Strategic Partnerships Manager here at CareMessage, and very excited to be sharing CM Light and our solutions with you today. We are especially excited to have Tammy Howell on today's webinar from North Country Healthcare. Tammy will be presenting a little bit about her organization's use of CareMessage, particularly during COVID-19, and recommendations that she has for you all as her peers in Arizona, sharing a very similar patient population that you all serve. And then, of course, we will save time for Q&A at the end of today's webinar, but please feel free to use the chat function or the Q&A function on Zoom to submit any of your questions for myself or for Tammy. We will be recording today's webinar, and we will be sending out the slides so that you have the opportunity to review these, and you should be receiving those tomorrow. Without further ado, I will go ahead and kick off our webinar by sharing a little bit about CareMessage, who we are as an organization, our platform solution. We'll do a brief demonstration and then save as much time as possible to hear from Tammy. Very briefly, an introduction to CareMessage for those of you who may be new to our organization. We are a patient engagement platform specifically designed for safety net providers in underserved populations. CareMessage is a 501c3 nonprofit that was founded in 2012, and we exclusively work with safety net organizations, meaning we work with FQHCs, community health centers, as well as PCAs and HCCNs across the U.S. To date, we have reached more than 6 million patients by way of our messaging solutions. And since March specifically, our organizations, our partner organizations that is, have sent over 20 million messages related to COVID-19. And we'll talk a lot about some examples of those messages, the different trends that we've seen, and then of course hear from Tammy specifically on recommendations and messaging strategies that she might have for all of you as well. We are especially proud to work with your peers in Arizona already, North Country, of course, as well as Sunset, El Rio, Santa Cruz, and others using both our full platform and our free COVID-19 solution, which we'll also cover today. Before going into our solutions overview, I did want to share Project Equity, which is a concerted effort that our organization launched in the spring of 2020 in response to COVID-19. So in addition to the free solution that we'll talk about today, Project Equity was designed to specifically reach safety net providers and organizations who were serving a significant proportion or percentage of patients in their population who were and are disproportionately affected by COVID-19. So that includes Black or African American communities, Latinx communities, Native American or American Indian, as well as rural and migrant patient populations. CareMessage as a full platform is a comprehensive messaging solution. So the majority of our full platform users do use CareMessage for appointment reminders integrated directly with the EHR for bidirectional messaging. We support quality messaging use cases, non-clinical use cases, a lot of which we'll talk about again in the context of COVID-19 when we discuss the message and the content that we create for our partners. We support one-to-one messaging, and we have an intense and heavy focus on chronic condition management and supporting those use cases, not only in sending out preventive care reminders and those wellness reminders out to patient populations, but also our health education programs, which are specific programs designed to help patients manage their chronic condition or to support a behavior change. I will move quickly through this, of course, because today's focus is on the free resources, but we're happy to take any questions during the Q&A or later on about our full platform. Of course, it's important to mention the work that we do with our EMRs, the different technologies we work with. I understand that many organizations in Arizona today may use our population health management solutions, so we do have an integration with that solution as well. Not only does CareMessage focus heavily on building great technology that, of course, supports bidirectional messaging, is interoperable with your EHR or population health management solution, but we have a heavy focus on content creation. We pride ourselves on the rigor and the thoroughness of our content, the thoughtfulness that goes into tailoring messages and creating content so that your organization doesn't have to recreate the wheel when it comes to content. And these are custom tailored for patients who may be managing multiple conditions or have cultural preferences or literacy barriers or even technology barriers. And all of our content is bidirectional. So you see a few examples here. And again, we'll go into a few examples as we discuss CM Lite. CM Lite is intentionally designed as an unintegrated solution for organizations in response to the pandemic who may otherwise not have had and don't have today an easy way to get messages out to your population. The functionality of CareMessage Lite focuses on two messaging types. So the first is group outreach, which is the ability to send a single message out to hundreds or thousands of patients, as well as one-to-one messaging, which is through our direct messenger feature, which, as you can imagine, is that one-to-one texting experience. And in and during the pandemic, and currently, we're seeing a lot of our SQHC partners using direct messenger for care coordination, any kind of patient support that you might be offering, particularly if you're connecting patients to other resources that exist outside of the clinic for housing assistance, for example, transportation assistance, food assistance. We're seeing direct messenger utilized heavily for that type of follow-up. I mentioned that CM Lite is intentionally designed as an unintegrated solution so that health centers that do want to get signed up with this free solution have the ability to begin messaging patients within a matter of days or even within hours of having access and logging into the platform for the first time. So in the product demonstration today, we'll go through what that file upload process looks like so that your organization, when you have a patient list or file out of the EHR or out of your population health management solution, you can easily upload that patient list into CareMessage and create a group for messaging. Similar to our full platform solution, we have an immense focus on content as well. All of our content is written at a 6th grade reading level or below. We offer our content in English and in culturally relevant Spanish translations. But of course, your organization has the ability to customize these messages. And again, as part of the COVID-19 solution that we've created, in addition to CM Lite being free for any safety net organization to use for a minimum of 60 days, our message library, as well as our telehealth tutorial video library, is free and accessible to any safety net organization, even if they're not using CareMessage or CM Lite, and we'll be able to share those links out in our follow-up so that you all have access to the message library. I want wanted to share and touch upon briefly a few examples of the types of messages that our partners have used CM Lite specifically for. There are 4 message examples that you see here, and the first 2 are actually a part of the messaging trend that we're starting to see, and what we saw over the course of the summer as health centers were reopening their operations or their regular operations and services, and many wanted to provide messages of reassurance out to their patient population that it is safe to come into the clinic, and if they prefer to come into the clinic or have a visit that they must be coming into, that the health center has taken the right precautions to ensure that it would be a safe and socially distanced experience for the patient. We also have seen health centers starting to adopt direct messenger to be able to help manage and promote social distancing. So asking patients, for example, to reply to a direct message when they've arrived to the health center parking lot to remain in their car, and then the health center will actually send them a text to enter the facility when it's time for their appointment. It's an example that we're seeing a lot of health centers starting to implement right now. And then the second example of messages that you see in the screenshots here below, these really have to do with social determinants of health and the work and the effort that we've seen health centers always thinking about in how to provide care and support to their patients in areas that aren't directly clinical. But of course, COVID-19 has exacerbated some of the social and economic needs that patients face. And so here you see an example of a health center sending out messages to patients, letting them know that they had housing assistance resources available to them, numbers to call for help. And then on the left-hand example, you'll see that this particular health center hosted a drive-through fruit and veggie pickup. And in addition to using CM Lite to not only share that information out with patients, they actually sent an online resource and asked patients to RSVP yes or no if they were going to attend the drive-through or come and do the pickup, so that, again, they could better anticipate the number of resources that they needed to provide in collaboration with the food bank that they were partnering with, as well as being able, again, to promote social distancing, so that it would be a safe experience for everyone. One more example, that we're seeing, and this should be no surprise to everyone here, is of course telehealth and the implementation of video appointments for patients right now. This is an example and messages that we're still seeing going out, but particularly in the spring when many health centers were adopting Zoom or Doxy.me to determine and figure out what technologies patients preferred for their virtual visit. So if they were comfortable and had access to perhaps Wi-Fi or a computer and were able to do telehealth visits versus a telephonic visit. And based off of how patients replied to this multiple choice surveying question, CareMessage and CM Lite can automatically provide the appropriate response with the appropriate resource. And so you see here the responses here vary, and I'll show you what this looks like in the product demonstration so that it alleviates the health center from having to filter through these responses, let alone respond to them individually. With that, I will go ahead and click into my demo environment. I will log into CareMessage. And you all will notice that right now in this particular demo environment, I do have a full platform environment, but we'll talk specifically about CM Lite and the free functionality available to any safety net provider to use for free. So on the left-hand side, we'll start with that file center process that I mentioned. So how to use CM Lite, how to get started. First, what a health center will do is upload their patients into CM Lite. With the file that you've generated from your population health management solution or from your EHR, you can upload that file and that list of patients, first and last name, for example, their phone number, language preference, and other demographic information into CareMessage. And upon uploading that file into CareMessage, you'll be asked and you'll have the option to create a group. A group will be a cohort created based off of all the patients in that file. And so you just see a few examples here that we have in the demo environment. Perhaps it's a cohort generated by a specific chronic condition or a specific need that they might have, or a message that you know has to go to a specific group of patients. And once you've uploaded all of your patients into CareMessage, you'll always have the ability to view them within the Patients tab here, and you're ready to begin sending messages. I'll click into Outreach, which is the ability to send a single message out to hundreds or thousands of patients. And so you'll see in the dashboard here, we have a variety of examples of messages that have already gone out. You can see historically what are all the different messages that my organization has sent out to our patient population. We'll click into an example here of a flu shot reminder that's been sent out. We know that now a lot of health centers both are CM Lite users and are full platform users. Flu shot reminders is one of the top use cases every year, but of course this year we know that this is so important to make sure that you're sending messages out to your patient population to confirm whether or not patients in this example had received their flu shot. CareMessage gives us a high-level understanding of how many patients have replied, did anyone opt out, and we have the ability to click into that specific cohort and review the responses that patients have sent or replied with. In this particular example, it's a small cohort, so it's very easy to take a look at the list. But again, when we start thinking about, for example, the drive-through fruit and veggie pickup example, where potentially hundreds of patients are being reached, you'll of course want the ability to filter by patient response. And CareMessage will even flag responses for us. So in this example, because it is a yes or no yes or no question, or in a multiple choice question, if a patient replies back with an unrecognized response, for example, they say, I don't know who this is, or I need additional help, CareMessage will recognize that and flag that patient for us so that we have the ability to do additional follow-up. I'll show you what that follow-up looks like in just a moment, but before I move out of Outreach, I will share very briefly how to create an Outreach, starting with selecting patients, so perhaps selecting a group that you created with the file upload process, or perhaps using the demographic data that you've uploaded to create a group of patients. I will go ahead and just select a group here. I'll select a few patients. And from there, I can either create my own message or copy and paste a message into the text box here, or I can use a template that I might have already sent out. With CM Lite specifically, we'll offer and create these templates for you. So we'll go ahead and we'll select that telehealth example that we talked about in the presentation. I can provide and add any edits or change these links if I want to. And upon selecting a date and time, I will go ahead and create my campaign. Before I hand things over to Tammy, I will just briefly touch upon Direct Messenger, which is the one-to-one messaging feature included in CM Lite. And again, one-to-one messaging, or direct messenger as we call it, is excellent for any type of patient communication for anyone within your organization when you need to have one-to-one discussion with the patient via text. And so you'll see that even in this particular demo environment and with this patient, there are a lot of different examples and use cases here. Perhaps coordination for getting resources sent to the patient, for a referral, perhaps in this example, just confirming and letting patients know that they have a virtual visit and sending the virtual telehealth login link, as well as confirming that they were able to connect with a local resource that they might have been referred to as well. With that, I would love to hand things off to Tammy to share a little bit about North Country and to share the work that her organization has done with CareMessage.
Thank you, Christine. Yes, so I'm so glad to be here today, excited to share with you what we do and how we use CareMessage. Of course, coming out of the marketing department, we focused everything, all of our efforts around text messaging in the outreach component. We do use the full integrated platform, so I just want to be clear about that. But we've been with CareMessage a couple of years now, and as I've said, it is probably the most effective way that tool that I've used to communicate directly with patients or groups of patients in any type of marketing effort I've ever done. And I've been with North Country since 2003, way back to the grassroots of what marketing looked like: a flyer in a laundromat with pull tabs on it for mammogram screenings, et cetera. And a lot of us still use those tools. But this tool has kind of taken us over that, into that next level. So as mentioned, our mothership is located in Flagstaff. We do have, we serve 6 counties. We're in 12 other communities. We've got 19 access points, 155,000 annual patient visits. We're in rural communities. Sometimes we may be the only healthcare provider. Other times we do have competition from the larger health hospital systems. We use, as it says here, a centricity, so we do the full integration. And then, of course, being a federally qualified health center, we offer everything under the roof. And we have used CareMessage to do a lot of promotion and outreaches for all the services that we've offered. So go ahead, Christine, and click to the next slide, and I'll tell you guys what we've been working on. So patient communication is always a challenge, especially on a broad level. So not even speaking, you know, to COVID, we're in areas where there could have been wildfires that we would need to communicate clinic changes, service changes, or snow issues, weather, all kinds of things. But what we've always run into is what's so complicated is being able to communicate those changes quickly to our patient population. Social media, the algorithms of Facebook, most of you may know, they are completely unreliable for any type of notification. I know most of you have probably seen something, big sale today, free tacos today, and you look at when that was posted, it was 3 days ago. So it's always old, outdated information that generally falls into the feeds. So we don't focus on social media efforts. We do in tandem use those, but we can't rely on them. A direct mail, it takes too long, it's too slow, especially when we've got to push information out quickly. So when it came to COVID-19, there was a few things that we needed to do right away. Of course, the press, there was all kinds of different stories in the media, and also stories varied between our populations. You know, we've got some different populations that are very rural, very conservative areas. Nobody's real sure what to believe. Then we've got others that are right on that, you know, bandwagon that everything's shutting down. So it was really hard for us to kind of keep the message straight. So it was important that we maintained calm and built community confidence. So we did initially, when COVID broke and we knew that the schools were shutting down and things were happening, we did a big, broad look back. We did a 5-year look back of all of our patients in our system and sent a message that we were still open and that we were here to help. That included about 92,000 cell phone numbers that we sent text messages to. There's no other tool that we could have, you know, used to make that happen. What we did to supplement that is we created a website, a web page on our website dedicated to all things COVID. So we had our resources and tools related to COVID. We had a message from our CMO on that page explaining what some of the changes were going to be, how we were going to be there to help. We had to talk about new care delivery models. We had curbside evaluations that we wanted to talk about. We had curbside pharmacy pickup that we needed to talk about. And we also had, of course, the virtual appointments. And then also we still needed ways to maintain our, you know, the routine health and immunizations that still needed to happen. So what we did with that, we sent out that initial 92,000 messages. After that, we did another follow-up round of messages based on the counties that we were serving. Messages went to those individuals as flare-ups started to happen. So naturally, being in Northern Arizona, Coconino County, Navajo County, and Apache County cover much of the Navajo Nation. So we were able to time our messaging, which was a lot of follow-up messaging, more reminders to populations or counties that started to have that increase. So we started with Coconino County releasing those, and then Navajo, Apache, and then we worked our way around the counties into Mojave County, Yavapai, and last Gila. Why I point this out is because there's really not a whole lot of tools out there other than probably direct mail would be the one, or direct calling patients, that you can actually segment your patient population, dial down to their actual demographic, their location, and send messages out that were relevant. So as we started to maintain that COVID messaging that we were open, we also continued to do our outreach screenings for our outreach programs. So the screenings, again, is mammography was a big deal. We've also started, the prevent type 2 diabetes, PT2 messaging. We're hosting virtual classes, health classes. And so we continued that messaging as well. The other thing that that happened during COVID, and most of you know, was National Health Center Week. So historically, we host health fairs in the spring. This year, of course, they were canceled. So what we wanted to do was an entire month of checkups, reminding people to get their annual exams, in particular, children. So we worked with the health plans, the Access health plans, send us the rosters of the patients that have been assigned to us, but have never had a relationship with us. So we sent those reminder messages to that patient population of letting parents know that we were available for kids' checkups in all of our communities. And then we also hosted kind of funny events around those. There were special instructions for how children and their parents were to check in, schedule, etc. The other component that we want to talk about that we use this for is also clinic closures and service changes, as Christine had touched on. OBGYN services, we definitely wanted these pregnant moms to be waiting out in their cars. So when we made any changes to those, we were able to let our OBGY patients know. In addition to, we also use the appointment reminder, which we put those special instructions in as well, but that's a different use for CareMessage. So when we closed, we had to close a few clinics not related to COVID, but we would just end the services in these communities. And so we would send reminders that we had closed, but please visit a neighboring location. And we had used the survey feature at one time to ask patients, because at some of these communities, we'd been there for 15 years. And so, we just wanted to get a handle on, do you still consider yourself a patient of North Country Healthcare? So we were able to look at that list as Christine had demonstrated. You see how people responded. We could look at the list to find out who doesn't consider themselves a patient, as they've established care elsewhere, and we could pull them out of our lists. So that's just basically some of the overview of our case uses for the messaging. And there are probably even things that I'm forgetting. But things that I do want to touch on that I think are really important, that we call kind of the texting best practices. And we have been hypersensitive to make sure patients aren't inundated via text message. So one best practice would be that if you send out a message to your patient population, a specific group, say hypertension, and you're calling, the call to action is to schedule an appointment. When you send out a reminder, it's good practice to probably scrub and compare that list to make sure that those patients haven't scheduled an appointment already. We certainly want to always look like, when using technology, that we know exactly what we look like, that what we're doing. We know exactly that our lists are clean. We've got our systems in order. Everything's great. So I urge you to always compare your lists and make sure that you're not sending somebody something that they've already received and already acted on, because as you know, as a consumer, generally, that's frustrating as well. Reading level and character count is always important. I will say though, with text messaging, of course, you only have so many characters to work with, but at the same time, it's a text message. You don't want a letter in that text message. So with that said, what I advise, what we do is we create website landing pages for almost every message that we send out with all the information that we want to talk about in that text message. So there's always a call to action with every text message we send out. We always want people to go somewhere. We don't want to just send them a notice. Generally, maybe we would for a snow closure, but there would always be a link to follow up for more information. Always use bit.ly links. We, as you saw also in some of the examples that Christine showed that she used bit.ly. Bit.ly is very important because on the back end, you can always at least track those clicks. And one thing to point out is that our click-through rate has been averaging around 13.5%, which is phenomenal for the healthcare industry. Healthcare averages less than 1%. typically, and maybe 2% is high if you've got a real good offering. So anyway, the other piece that I guess I wanted to talk about a little bit again is that segmentation, as Christine had talked about, that the way that you can just take your patient population, your panel, and you can slice it and dice it any way you want to send out those special outreaches. You can by age, by gender, by location or county, or any way possible. It's up to you. You can pull those lists, build those groups as she showed, and you can do that targeted messaging. So I think that that's just about everything that I wanted to touch on. And so I will go ahead and turn this back over to Christine, and I'll hang on for questions at the end.
Wonderful. Thank you so much, Tammy, for sharing that. Congratulations to all the work that your organization has done throughout the years using CareMessage, but particularly during this time, and that click-through rate metric especially stands out. As we wrap up today's webinar, we'll just touch very briefly and to give folks a little bit of context again to simplify the differences between CM Lite and CareMessage Full Platform. And then most importantly, we will be sharing out the resources that we have mentioned today, the message library, the telehealth video, the recording to this presentation, and the deck, and then of course, steps for getting started with CM Lite. If your organization or if you're interested in learning more, we are excited and happy to have that conversation with you. With that, I will open up the webinar to any questions. Please feel free to submit those via the Q&A chat box or the regular chat box as well. We have one question from Kasia, and I'll read it out loud for those who may only be dialed in. Is there a right number of text messages to send out so the patient doesn't feel overwhelmed? For example, if we send a text message on hypertension, like the speaker said, how long do you wait typically before sending a second text to the segmented group? Tammy, I know that we've, here at CareMessage, we've worked with organizations to provide some recommendations there, but I think it's most helpful for the folks to hear from you and how your team thought about the cadence and frequency of messaging.
Yeah, good question. It just really depends on, of course, the message. If you've got a deadline to meet, you're trying to fill, say, a mammogram roster, it's typical that you would send out that communication maybe 3 weeks in advance. Wait a week before the event for the reminder, and then that's probably enough. If it is something as you're closing a location or something that you really need people to know, a couple of reminders within a certain amount of time is good. Also, it's a good idea to keep an eye on your, whatever your call to action is if you're getting close to the fill date. You know, sometimes if if, for example, as I use to trying to fill a schedule or a roster, it's okay to probably do a blast, maybe one last push, last chance, please schedule today type of communication is probably typically where I would leave that. However, I do want to say that that's why I really stress on comparing those notes of to who's scheduled and who hasn't in your email list. Because that way you're not inundating those that have already taken action. So those that haven't taken action probably need that little extra nudge and likely won't be annoyed. They do have that opt-out, which again, I don't know if I mentioned, but our opt-out rates are quite low. I'm always surprised when we go back in and look in a communication, maybe 2 or 3 out of a few thousand people that we've actually sent the message to. So anyway, I hope that helps answer your question.
Great, thank you. I see one question in the Q&A box. It reads, can CareMessage be used for other databases as well, such as donor databases? And I'm not sure if the person who submitted the question wants to clarify on donor databases. It sounds like the question may be, is CareMessage limited to patient communication? It certainly isn't. We have seen organizations, for example, use CareMessage to reach out to their community health worker teams or even just staff and providers, particularly during COVID-19 or here where I'm based in California. We've seen examples of our customers using CareMessage to communicate during the wildfires around clinic closures and to make sure information is getting out to the entire staff and team. So it is possible, certainly depending on who is a part of the donor database, we might have recommendations as to whether or not those use cases would hold up under the CareMessage product structuring, but of course it is possible to message folks who may not be a patient. We'll give folks just another minute or so to submit any questions. And of course, if any questions come to mind after today's webinar, please feel free to reach out to CareMessage with those. We're happy to reply. Should there be any specific follow-up to Tammy, we're also happy to forward those questions along to Tammy. But we'll give folks about another 30 seconds or so while we're all together. Okay, we will go ahead and wrap up. Again, we will be sending out the recording to this presentation, the slide deck out after today's call. Thank you so much to Tammy. Thank you to the work that you're doing with CareMessage for sharing those examples with us. We're so appreciative of everyone making the time to join us today and wishing you all a safe and healthy afternoon. Thanks so much.